I'm Dr. Nabeela Ali. I'm a public health physician working with John Snow Inc. in Pakistan for a USAID funded project, Pakistan Initiative for Mothers and Newborns. The project was for 6 years and we were working with 35 million people in Pakistan out of 186 million total population. Why Pakistan? Because Pakistan is the 6th most populous country in the world and we have one of the highest maternal mortality rates in Pakistan. Mothers are dying needlessly in Pakistan. Newborns are dying from reasons which are preventable. So that's why, Pakistan is a place which is contributing to the global mortality for mothers and newborns. Maternal mortality is a very, mothers die. Why mothers die? It's a very complex thing. It's not just patient-doctor relationship. It has got so much to do with the behaviors, with the communities they live in, with their house, at the household level, their family members. So there are interventions there. We need to have such interventions whereby we can stop mothers from dying, and because there are purely preventable reasons for that. The goal of PAIMAN project was to reduce maternal newborn mortality through viable and demonstrable solutions so that they are sustainable and Government of Pakistan can then scale them up and there is continuity even after the project is over. So we worked with a range of target audience and one of them was ulama, because when you're coming up with a strategy how to reach out to those who are unreached, women who are poor, women who are living in conservative conservative areas where no one can reach. That's where we targeted, and we found out, through research that there are several target audience, and one of the most important, especially in those conservative areas, were religious leaders. So we had to. So it was not one size fit all strategy. Working with religious leaders, you need to understand what are the do's and don'ts, because it's not an easy intervention. Religious leaders, they're not technical people, but they're experts in their own field. So you have to approach them with trust and with respect. And once, the first step is out of your way, which is establishing rapport with them, then they listen to you. So that is how we approached them, and never through a technical person. It was always through an alim whom we had already sensitized. So he would go and speak to them, and if they found that the religious leader was receptive and is willing to be part of the project, then we would go and have individual and group meetings and invite them in collaborative decision making and developing messages which were more in the light of the religion. One of the opportunity that we look at in through our religious leader intervention is that this has been picked up by Government of Pakistan as one of the 9 best practices to be scaled up. So we are leaving behind 800 ulama who have been sensitized, and we even build the capacity of a local organization, NRDF, so that they can, it's a faith-based organization, so that they can carry forward the work that the project was doing. But there are challenges working with religious leaders, and one of the challenge is that we should have a program approach and not a project approach, because we don't want to create hype and we don't want to engage them, build their expectations, and then all of a sudden when the project ends, then what should they do? So it should be a program approach rather than a project approach, and that to me is more sustainable and will succeed.